today is Building Resilience for Home Visitors, Supporting Families Experiencing Mental Health. And I'd like to welcome Anita Whelan, who will introduce herself in a few minutes. And as always, we will have breakout rooms, which will be for about 20 minutes at 12:15. And we will be feeding back the information that was shared in the breakout rooms. Obviously, the breakout rooms will not be recorded, but when we come back and wrap up, that will be part of the recording. And as Michelle said, all the videos of this series are available on the Home Visiting Alliance website, which is www.hva.ie. So, Anita, we're just going to show you again the Home Visiting Alliance. As you can see, there's a map there. I'll just mention the map there, and as you can see, all those dots around the country are where the various programs are operating from. And we can just go to the next slide. And the Home Visiting Alliance is made up of various home visiting programs. And if you can just put that onto that slide next, so I don't miss anybody. So there's the Parent Child Plus program, Preparing for Life, Let's Grow Together, Prevention and Intervention Network, Community Mothers, hopefully to be community families, and finally, Live Start. So I'd like to introduce Anita. So Anita, do you want to take it from there?
Yeah, I will. Will I share my screen? Will I put the presentation up? Sorry, just bear with me. Now I'm just going to, sorry about this. Is it share the screen, isn't it? Share screen. Yeah, I have it here now. Can you see that?
Yeah, if you just want to put it into presentation mode, then it'll be fine. Happy days, best of luck.
Thank you. Now, I think we have it there now. Can everybody see that? Yes? Yeah. So
we're fine.
I'm Anita Whelan, and I'm going to do the next hour on building resilience in home visitors, supporting families experiencing mental health. So the session is about to gain an understanding of mental health, to get a general overview of mental health, what are the myths and facts associated with mental health, understanding strategies that will support implementation of home visiting programs, engagement and retention of families, signposting and support the well-being of home visitors. So just to say that while we're doing the session, again, these are just a few ground rules that I would normally do if I'm doing a workshop with mental health. It's always to respect who's going to contribute, and especially if you're in your working groups. Again, confidentiality, what we share remains in the group. Openness, are you willing to be as honest and open as possible? Don't share too much personal information, and just be mindful of GDPR and confidentiality. Again, let there be no judgment, and the sensitivity around, remember that everyone is different, we all come from different backgrounds, and just avoid sensitive remarks. And again, mental health is such a heavy subject and topic. Just have a bit of fun, and we're creating a safe space where amongst the community, and the group consciousness is extremely powerful. So just we all learn from each other all the time. So just to say a little bit about myself, I have worked in the community and voluntary sector for the last 30 years. I am a mental health executive, life and NLP coach. I'm a Heal Your Life practitioner and coach, a management and leadership consultant, and CEO of an organisation. And I spend very little time at home. That's a joke, you know, I do. But I was a manager of a home visiting teen parent project for many, many years as well. So that's just a little bit about me. Sorry. Won't seem to go on. Okay, hold on. toolbar upgraded, sorry. Now, it's like as if it's after locking. Now, sorry. So linking home visitors and mental health. So this is just a snapshot of research done about mental health and well-being amongst home visitors, the stressors, supports, and the service implications. So again, this is a snapshot. So home visitors work with families. Sorry, I'm just going to push this up here because I can't see the screen. Who can often experience multiple layers of stresses, including poverty, parenting, housing, violence, mental health. There's a layer of stressors that home visitors see on a daily basis. So home visitors are key to delivering those named layers of stressors. Mental health can be a barrier families face on a daily basis. And it's a very, very sensitive subject to approach with families, particularly if that's not your expertise or your area. It can be a challenging conversation to have with families that you visit. Mental health is not just for families who we support. Mental health is an invisible cloak that holds many families hostage. And reoccurring exposure to the challenges and trauma families face on a daily basis can contribute to burnout, poor physical health, and even cause secondary trauma to the families that are facing these concerns, and for the home visitors as well. In the research, they found that services, a lot of home visitors and services understand that the programs and supports provided through the home visiting services can be the difference to the cycle of life that people live. Therefore, home visitors work tirelessly in the retention of holding on to families and supporting families. The research also showed it's really important to note that hidden work that the home visitors do, because often this work is very emotional and it's often not captured, and can be very hard to measure. The research also showed that often the success of home visiting programs rely on the home visitors' professional practice, knowledge, and empathetic relationships that they have with families. When mental health issues arise for families, home visiting work can become very challenging, and often a slower pace is required for the families because they're unable to keep up with the normal pace that you might have with families. It is a must that home visitors become very aware that when they are affected and triggered themselves, that this too can bring about mental health concerns as well. And just to be mindful of that if any home visitors have concerns about themselves or they feel triggered, that there is always space to go back to your supervisor, manager, team leader, or whomever you would go to. And it is not a failure on the home visitor if families drop out of services. Often families experiencing mental health are hard to reach and they're actually just not ready yet. So it's not a failure of the programme, it's not a failure of the home visitor. Sometimes it's just families are not in that particular space. So that just all came out of that piece of research. So I'm just going to move on. Again, it seems to be locking every time I go into it. Now, so the myths and facts. Michelle, I'm getting some people to admit. Is that okay that I admit them?
Yeah, no, it's okay. I'm going to click on it every time we see them.
Thank
you.
You're fine. Thanks very much. So the myths and facts. So these are some of the myths that are out there. So children do not suffer from mental health issues. So again, research published by the Royal College of Surgeons in Ireland revealed that 1 in 3 children aged between 11 and 13 years of age will experience mental ill health. By the time the child reaches 24 years of age, it is estimated that over half of the young people in Ireland will have experienced a mental health issue at some time in their lives. Most common forms in young people is anxiety and depression. So myth 2, it's the parent's fault if their child suffers from a mental health issue. So while an unsupportive family environment can have an effect on a child's mental health, there is so much more to consider. Problems can generally be boiled down to a combination of nature and nurture. the interaction between our genetic makeup and our social environment. So that's not always true. So myth 3, people with mental illnesses are crazy and dangerous. This is a dangerous misconception, with 28% of people agreeing that people experiencing mental illness are crazy and dangerous. This is not true. Some of the most common mental health issues include depression and anxiety. People with these disorders often experience negative thoughts and low moods, which can impact on their lives. Violent outbursts are not part of the diagnostic criteria for either condition. So I'll just move on. So myth 4, people who have schizophrenia are dangerous and violent. There is a misunderstanding about what schizophrenia is and what kind of characteristics are involved. The truth is that schizophrenia is a collection of symptoms that are both positive and negative. While it does have hallucinations, delusions, and confusion, these symptoms do not necessarily result in dangerous behavior in everyone. In the same way, not everyone will get an infection that needs stitches, so we have to be very mindful of that. So, sorry, I'm just moving this up out of the way. So myth 5, people should just snap out of depression. I'm sure we've all heard that at some stage. Depression is not just characterized by low mood, it is also affected by the neurotransmitters in our brain. These are chemicals in the brain that transmit messages from one neuron to another, telling our brain to act in a certain way. For example, the release of neurotransmitter serotonin tells our brain that when we are happy. Depression has been linked to the impaired production of this neurotransmitter, as well as dopamine and neurohypophrine, which controls the body's mood and reward seeking. This is why we can't just snap out of depression, as it's difficult to alter our brain chemistry without help. So another myth is addiction isn't a disease, it's a lack of self-control. Now, I've heard that through my work in life many, many times. So drugs and alcohol alter the brain's reward system and result in distinct psychological damage when used and abused long-term. When we do something we enjoy, for example, reading a book or going out meeting friends for coffee or having a laugh or going for a walk, the brain releases reward chemicals such as dopamine and glutamate. This release allows us to feel happy on the inside. This reward circuit is damaged in those who suffer from addiction. Drugs damage the brain's natural reward system by mimicking neurotransmitters, and the brain works overtime to generate a reward sensation. An addict's natural ability to sense joy is alarmingly low, and so in turn a lot of people will go back to using drugs. So just moving on. Sorry, just have to move you around the page. So myth 7, the Irish are more prone to mental illness. I don't know if any of you have ever heard that. I've heard that a number of times. The first and most long-standing myth is that the Irish are more prone to mental illness than other people. But the myth of the mad Irish is just that, a myth. We Irish are no more likely to develop mental illness than anyone else. For much of the 1900s, Ireland had more mental hospital beds per head of population than any other country in the world. But the reasons for this were many and varied, including bad laws, a society generally unwelcoming of those who were different, and powerful societal interests supported mental hospitals. Therefore, what Ireland experienced was an epidemic of mental hospitals and not an epidemic of mental illness. So another myth is people with mental illness are a burden in the workplace and shouldn't be allowed to work. An individual working in a positive environment in a role they like is unlikely to miss any more days of work than their colleague who does not suffer with mental illness. There has been an increase in an attempt to change the view of mental health within workplace environments, and that is very true. Myth 9, you can only have one mental illness at a time. This is untrue again. Anxiety disorder is an umbrella term used to describe a range of illnesses that share common features, but are also distinct from one another. For example, general anxiety disorder and social phobia anxiety disorders can also overlap or coincide with other disorders, such as mood disorders, which can include depression. Dual diagnosis is a term used to describe diagnosis involving disorders such as depression, along with addiction. So, and the final myth, you can never recover from a mental illness. Treatment is very effective for mental health disorders, but it is important to find what works best for people. Oftentimes, certain forms of talk therapy will be enough, will be sufficient. Other times, mindfulness practices, other times alternative practices can work for people, and other people might take medication. So it's a combination of different therapies that work for people. And again, the key message is, don't lose hope if the first path doesn't work out. Long term, sometimes it takes a little trial and error in order to find out what suits best for a person. So, sorry, over here now. So I suppose I'm just going to ask people questions in relation to, have you ever had any physical issues? You know, and if you have, just raise your hand. So have you ever broken a bone? Have you ever cut your finger? Have you ever had a headache? Have you ever had a toothache, tummy ache, fallen and been in pain? Yes, 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 yes. I think all of them for me. I have experienced all of them myself. So they're very evident, very obvious. You can see all of that. You know, you can see when people are hurting or in pain or in agony. So again, now I want you to think about, have mental health concerns for yourself? Has anybody ever had mental health concerns for themselves? I know I have. There's been times. For a family member, absolutely. For a friend or a colleague, absolutely. And sometimes that's much harder to see. So have you felt happy in the last month? I have. Have you felt sad in the last month? I have. Have you felt excited in the last month? I have. This is a waving exercise. Have you ever felt scared in the last month? Absolutely. Have you felt worried and overwhelmed in the last month? I know I have. So these are all emotions that come up. And if you can cope with these emotions on a daily basis and know they will come and go, your mental health is reasonably fine. It's when these emotions stay stuck and they carry over from day to day and day to day, that's when mental health concerns come in. I'm going to further go in now and explain a bit more. So oftentimes mental health is actually hidden in plain sight, you know. So mental health is about how we think, we feel and act. Just like physical health, everybody has it. So I'm going to try and play a video. I hope everyone will, I'm going to press play here, will be able to, if you're on your laptop or your phones or computer, if you want to hire it up. Now this video was on YouTube, and the following, it's only for 2 minutes. The following video addresses themes of mental health and suicide. Now, just to put a little warning, a red flag, it can be distressing. So just be conscious, and mind yourself, be conscious of yourself, okay, while watching it. So I'm going to press play, and I hope people will get to see it. I'm not sure how this is going to work out. No?
Can't hear it.
You can't hear it?
No. You may need to stop sharing, share again, and there's a click at the bottom of the screen that says share videos too.
Share videos too. Okay, so I will
stop sharing.
Stop sharing. Hold on up here. Sorry, why? Sorry, I can't pause share. Hold on.
I can stop you sharing there.
Can you? Thanks.
Now,
Now,
if you reshare, and then there should be a click at the bottom of the screen saying about sharing videos, something to do with sharing
Optimize for
videos, and
video
you have to
click.
click it. Yeah,
okay,
and
brilliant.
hopefully that will work, people.
Right. Hopefully. Okay, I'll try it again and see.
Oh, wow. How you doing? You good?
Yeah, it's working.
Okay.
How you doing? God, it's exciting, isn't it? Hey? So, how's the week been? Okay. Yeah. Yep. I hope things are better outside of football.
Did everybody see that?
Yeah, Anita, everybody could
Yeah.
see it. Wasn't expecting that, actually.
Okay,
Yeah.
That's why I was just saying it may be very distressing. So, do you know what I'm after losing the images of yourself. So will I just carry on then? Is okay?
Yeah, all's good.
So when you're dealing with mental health, sometimes how do I know if someone has mental health issues? Sometimes it would be seen very obvious when someone's going through a hard time, but there is no simple way of knowing if they have a mental health issues. And sometimes you don't need to know. It's more important to respond sensitively to someone who seems troubled than to find out what issues they have. However, you can support them to contact the relevant practitioners or redirect and signpost them to get support, which could lead to a diagnosis. Remember, not one of us will escape going through rough times. And for most of us, there have been times in our lives when we have been affected by mental health, or someone in our lives has been affected by mental health. Most of the time, we can navigate and support people through these challenges. However, when we know it is beyond our controls, this is when the time is to gently navigate them towards other supports. If you don't, you can feel like there is actually a lot on your shoulders. So just to be mindful of that. So what is mental health? From the World Health Organization perspective, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is also able to contribute to his or her own community. So that's the World Health Organization's perspective on it. So there are other definitions of mental health. So definition is from Friedel is mental health influences how we think and feel about ourselves and others and how we interpret events. It affects our capacity to learn, to communicate and to form, sustain and end relationships. It also influences our ability to cope with change, transition and life events, such as having a baby, moving to a new house, experiencing bereavement. So the World Health Organization describes mental illness as health conditions involving changes in emotion, thinking or behavior, or a combination of these. And mental illnesses are associated with distress and or problems, functioning in social, work, family activities, and diagnosed illnesses. So mental health is not just an absence of disorder. So when we're in good mental health, we have the capacity to think, to feel, and to act in ways that enhance our ability to enjoy life and to deal with challenges. When we move into mental health problems, this diminishes our capacity. So our cognitive, emotional, and behavioural behaviours get affected. And this interferes with the enjoyment of life and our interactions with society and our environment. So then if you move into mental illness, these are conditions that affect a person's thinking, feeling, mood, or behaviour, including depression, anxiety, post-traumatic stress disorders. So I just can't see anybody. So am I okay to move on? Yeah?
Yeah, Anita, you
Yeah.
go at your pace, it's
Yeah.
fine.
Grand. So what is a mental health problem? So a mental health problem is when the way you're thinking, feeling, or acting becomes difficult for you to cope with. When we can all feel sad, as we said earlier on, we can all feel worried, we can feel angry, or even fed up at times, like having an argument, challenges in work, nerves before an exam or an interview, or feeling down because you didn't get the job that you wanted. These are acceptable emotions. However, when these feelings last a long time, it may be a sign that you might need more help. For example, if the way you feel impacts you most days, stops you from doing the things you enjoy, makes you feel like you can't cope anymore. So mental health problems are very, very common. So there's various different categories. I'm not going to go in too deep to them all. So there's common mental health disorder, depressive disorders, anxiety disorders, somatic disorders. Then you have the neurological conditions, epilepsy, dementia. Severe mental health disorders is psychosis, hearing voices, seeing things. Again, substance use disorders, alcohol, tobacco, other illegal substances. And then child and adolescent mental disorders are intellectual development disability, IDD, attention and ADHD, and then oppositional defiant disorder, ODD, and conduct disorder. So factors affecting mental health. You know, sometimes people think it's one, it's maybe the environment, or it could be, you know, in people's genetics. But sometimes, most of the time, it's a combination of things. So biological factors. So it could be chemical imbalance in the brain. It could be genetics, brain injury, chronic illness, medications. It could be psychological factors, poor self-esteem, negative thinking. It could be the social factors in your life. So your maybe a family conflict, poverty, unemployment, poor housing, infertility. And then back to our past events in childhood, violence and abuse, emotional neglect, death of a parent. So there could be one, or there could be a various combination of factors that could affect people's mental health. So this is just a continuum, and I'm not going to go into this too deep, but this is when you're really healthy, when you go into the reactant phase of your health, mental health, when you go into the injured stage, and then when it goes into ill health. So I'll just go through one or two of them. So on a normal and a healthy perspective, you have normal mood fluctuations. So you go in and out of them on a normal day. When you're starting to react, you know, when your mental health is slightly affected, you might become more irritable and impatient. And then when it goes into that your mental health is affected, you go into that state of anger. And then when it crosses over into ill health, you go into angry outbursts and aggression. So they're just categories that kind of go into that. So I'll just take the second one. So again, when you're fairly healthy, you're calm, you take things in your stride. When you're reacting, you go into that nervous state. When you go into the kind of the injured, you go into that anxious state. And then the ill state, excessive anxiety and panic attacks. So I'm not going to go through them all. I just said I'd put that up as kind of a map to see kind of how language is used kind of around mental health sometimes. So statistics on mental health. So, sorry, I'm just going to move this a little bit so I can see. So how is mental health in Ireland? So just research was concluded by Maynooth University, the National College of Ireland and Trinity College of Dublin. And the findings show that 42% of adults in Ireland are likely to be experiencing a mental health disorder at any point in time. So again, sorry, that correlates with studies in the World Health Organization, which indicate that this figure is similar to what has been found in the United States and New Zealand. So according to the Irish Times, Ireland has one of the highest rates of mental health illnesses in Europe, and reports finds mental health problems cost the Irish economy over 8.2 billion a year. Right. So this was a study that was done, Aware's National Survey. An online survey was conducted by Amaranth Research with a nationally represented sample of 1,200 adults in 2023. So the research revealed high rates of depression and anxiety in Ireland, with 60% of those surveyed experiencing depression and 80% experiencing anxiety. So the key findings of the study are 42% of adults in Ireland met diagnostic requirements for at least one mental health disorder. The most common disorder was insomnia disorder at 15%, and other notable disorders were more major depression disorder at 12%. Alcohol use disorder was 9%, and generalized anxiety disorder was at 7%. People in the population of the research most likely to have mental health disorder were younger in age and were working in jobs requiring shift work and had experience in traumatic life events. 11% of respondents reported having attempted suicide at some point, and people with a mental health disorder were 5 times more likely than those without to have attempted suicide. Mental health disorders most strongly associated with having attempted suicide include psychosis, complex post-traumatic stress disorder, insomnia, and borderline personality disorder. So, key facts about mental health disorders. Mental health does not discriminate. It affects all classes of all people, all genders, adults and children. So quite common, 1 in 4 people will experience mental health challenges. Mental health doesn't always look the same. Mental health can range from common to severe conditions. Mental health is more than just stress. It may be brief or long-term, and it affects the quality of our life, our work, our relationships, and so on. Mental health can ripple out and can affect an entire family. And there are effective forms of treatment. 1 in 6 workers are experiencing depression, anxiety, or stress, and women are twice likely as men to develop depression. A depressive episode can last about 6 to 8 months on average. So signs and causes of mental health. I feel I'm flying through this, so apologies if you think I am. If you have any questions at the end, please ask. So the 7 signs of mental health issues are change in feelings, a loss of interest, a change in sleeping habits, low energy, difficulty interacting, appetite or weight changes, uncontrollable emotions. So although certain symptoms are common with specific mental health problems, no 2 people behave the same way when unwell. You may notice changes in their behaviour or mood if you know the person well. So again, causes of mental stress can be work-related stress, relationship stress, financial stress, parenting stress, health stress, life changes. They're just a few examples of causes of mental stress. So again, whatever family you're visiting who is experiencing mental health, it's really, really important for them to know that they're not alone and they deserve support. So that's kind of a big thing. So I just decided to put up kind of the terms that we use when we talk about mental health. And these would have been the terms when I managed a home visiting project. These are some of the common terms that would have been used when families, discussing families that were experiencing mental health. So I'll just put this up, sorry. With stress, I think everybody talks about stress. To a degree to which a person can feel overwhelmed, stress is to a degree to which a person can feel overwhelmed or unable to cope as a result of pressure that are unmanageable. Stress can impact on how we feel emotionally and physically at any moment in time, but it really is important to note that stressful moments can pass. Stress is not a psychiatric diagnosis, but it's closely related to your mental health, as stress can be the cause for mental health problems and make existing problems worse. So again, for example, if you often struggle to manage feelings of stress, you might develop a mental health problem like anxiety or depression. Furthermore, mental health problems can cause stress. You might find coping with day-to-day symptoms of your mental health problem, as well as potentially needing to manage medication, healthcare appointments or treatments, can become extra sources of stress. So I'll just move on. Fear. Fear is one of the most powerful emotions we can have. And I think everybody that I would know can identify the fearful moments has come and gone in their lives. But fear can have a very strong effect on our minds and body. Fear is a natural emotion, but when the emotion grows into an anxiety, and it actually stops us from doing things, this is where it can affect our mental health. Anxiety and adrenaline are connected to the feeling of fear. So fear can be masked in various ways. One example is the fear of doing things because you fear being judged, or fear of meeting new people, or whatever the fear is. Fear is something that we consider is a bad thing and makes us make bad decisions, and it can do. However, fear is also a good thing because it is the response to our survival, which keeps us safe and alive. If we were not able to feel fear, our instinctual states would be compromised. So fear is not reasonable when it keeps us from doing what we want or following areas in our lives that are not good for us. This is when fear blocks our well-being and gets in our way. Now, I know from working, with families over the years, fear could be maybe joining a new group or meeting new people. So it can block us and can have an impact on us and our mental health. So anxiety. The term anxiety refers to feelings of worry, nervousness, apprehension, or fear commonly experienced by people when faced with something they view as changing. So everyone can experience short-term anxiety. Even those that don't have anxiety can get anxiety when confronted with a situation that causes nervousness. People get anxious on meeting new people before tests, when they have a meeting with their boss, and anxiety is an incredibly normal experience and but nonetheless, it can be disruptive. I had anxiety coming on this morning, but here we are. So the difference between anxiety and generalized anxiety disorder. Generalized anxiety disorder is when someone has GAD, G-A-D, their fight or flight system is firing on all cylinders throughout the day, predominantly at low levels, and occasionally can pick up to high levels at random times. So they can go from being really, really low to being quite chronic and quite high. This is being in a constant defense state. It can often cause shaking to occur in the body. People over the years I know have described it as kind of like, a sensation within their stomach, where this constant shaking, or their hands or their body feels like they're shaking. And then you're most likely to be diagnosed with general anxiety disorder if you've had the symptom for 6 months or more. So panic attacks as well, that's common language that's used every day. I know it was for us when I was working with home visiting families. Panic attacks create a feeling of sudden and intense anxiety. So panic attacks can have physical symptoms, including, again, the shaking, feeling disorientated, nausea, rapid irregular heartbeats, dry mouth, breathlessness, sweating, and dizziness. It is also possible to experience panic attacks during a stressful life event than never before experienced. For example, a person who is a victim of a crime or an assault may have a panic attack during that event or even following the event, which would lead into post-traumatic stress. To be diagnosed with a panic disorder, a person would need to have recurrent and unexpected panic attacks. So again, this is leading into post-traumatic stress. So, post-traumatic stress disorder is a disorder, that develops in some people who've experienced a shocking, a scary, or a dangerous event. People may experience a range of reactions after trauma, and most people recover from initial symptoms over time. Those who continue to experience problems may be diagnosed with PTSD and may require medical or other supportive measures. So common symptoms of post-traumatic stress disorder, again, vivid flashbacks, feeling like the trauma is happening right now, intrusive thoughts or images, nightmares, intense distress from symbolic reminders of the trauma, physical sensations such as pain, sweating, nausea, or trembling. So again, post-traumatic stress, it's psychological, it affects we can have nightmares, flashbacks, behavioural, we avoid certain situations and environments, we're hyper-vigilant and hyper-arousal, startled by the smallest trigger. So depression. Depression is a common mental disorder characterised by persistent sadness and a loss of interest in activities that you would normally enjoy, accompanied by an inability to carry out daily activities. So depression actually affects 1 in 10 people during their lifetime. So again, some common types of depression are depressive episode, bipolar disorder, postnatal depression, seasonal affective disorder. I can never say that word. If you just want to just read it there, so these are from the Central Statistics Office, and I don't think this will be any new revelation here for anybody. But again, this is in relation to depression. So if you're unemployed, that you're more likely to have minimal depression, moderate depression, mild depression, and then more severe depression than if you are in employment. And that's not to rule out that people in employment do not suffer with depression. They do. But when you're unemployed, the CSO office have recorded that the numbers are much higher. So I'm just going to play another video. This depression about Black Dog. Is that okay? Did I do that?
Yeah, go for it, Anita. I'm sure it should just play now.
Yeah, okay, I'll just press play. Thanks.
Yeah, we have it.
Great, thank you.
Living with a Black Dog, a guide for partners, carers and sufferers. What not to say or do. You may well be right when you say, it's all in your head, but don't say it. Leave that up to the professionals. Be a man. This certainly doesn't help, especially if they are one already. Depression is an illness, not a sign of weakness. Don't be an armchair general who gives unfounded advice and orders. Being thoughtful and kind will never go amiss, but don't try and jolly them along. It can often make them feel worse. Don't point out that there are people in this world far worse off than them. It just adds to their feelings of guilt and hopelessness. Good things to say and do. Be sensitive about how you approach the subject. A lot of people aren't used to talking about their mental health or lack of it. Crossing that line simply means you care. Try not talking. Instead, grow your ears and open your heart. Really being there for someone without opinion or judgment is one of the best gifts you can ever give. Encourage them to seek a professional opinion and offer to help find a good doctor, make an appointment, and even going with them can be hugely beneficial. Encourage any form of regular exercise. Fitness robs the dog of its power. Help them develop a strategy to simplify their life, both at home and at work. Stress is one of the biggest drivers of depression. Less stress means less dog. Make them a ditch the dog box. Encourage them to fill it with favourite photographs, letters, or anything that reminds them of what's good in their life. Include a dog journal. Here they can plot how they're feeling, acknowledge progress, record the things they're grateful for, and set doable goals. Embracing the black dog. Agree to a course of action to get rid of the black dog. An ignored dog can become a big problem. Learn about the condition together. Knowledge is power, and validation is a great healer. A united front is crucial in getting the black dog to move on. As a caregiver, compassion, empathy, and understanding are vital, but recognise that you alone don't have the power to rescue your loved one. Professional help is often what's needed. Finding the right doctor can make all the difference to a healthy recovery. If they're going to tell someone their problems, it should be someone they respect and feel comfortable with. Don't be afraid to go for an initial assessment, and don't feel committed to continue if it doesn't feel right. If it's suggested you take antidepressants, do your research, know the facts, and ask your doctor plenty of questions. A big obstacle for seeking professional help is the cost. Help them realise that the cost of not getting the right help can be considerably higher. It can cost marriages, friendships, jobs, and even life itself. Some simple rules of engagement and agreement. Agree that there is a black dog in your midst and things may have to change temporarily. Agree that no one can help them until they fully commit to helping themselves. Agree to be gentle and respectful with one another during this time. Agree to check in with each other on a regular basis. Agree to communicate honestly and openly. Agree to the course of action set by their doctor and to review progress regularly. Self-preservation for the caregiver. It can be difficult not to take anger, criticism, negativity, and apathy personally. It's important not to buy into it. Accept that it's the depression barking, not the person you care for. Being overexposed to someone else's black dog can begin to rub off. Misery loves company, so try not to get sucked into the vortex. It's really important to recognise and honour your own needs, limitations, and boundaries. Difficult situations are better dealt with when you are calm and in the moment. Yoga, meditation, and mindfulness are great tools for achieving calmness and control. Join a support group. There's nothing like being in a room full of people who understand and share your story. It's important to get out and do your own thing and be with friends. Friends may not be able to solve your problems, but they can offer incredible support, comfort, wisdom, and laughter. A black dog in any relationship can be confronting, frightening, and frustrating. But navigated together, the bond can become deeper, richer, and better for it. And finally, the most important aspect of this journey is to constantly remind each other, it will pass, it will pass, it will pass. If you have a black dog in your life, get help, be helped, and always hold on to hope.
So that was from the World Health Organization. So if anybody wants to watch that again, you'll find it on the internet, on YouTube. So the new complexities home visitors are facing. I'm okay to go ahead, yeah? Because I just can't see anybody at the
Yeah,
moment.
keep going,
Yeah,
no
great,
problem.
great. The new complexities home visitors are facing, and they're probably not new complexities, but they have increased. Home visitors are faced with a lot of migrant families now. So home visitors are faced with language barriers, cultural barriers, religious barriers, and often families faced with post-traumatic stress. So it's so important that home visitors become aware that they can only do their job, and oftentimes limitations, expertise beyond their controls are factors they must consider. It is so important to seek support from your organisation or refer on where possible. So I just did a kind of like a brief overview of, I suppose, different types of families that are coming in through home visiting services. So the asylum seeker are people who file for an application for asylum in a country other than their own. They remain with the status of asylum seeker until their application is considered. And if they are recognised in needing protection under the 1951 Geneva Convention status, they will become refugees. So then we have, a refugee is defined as someone who is seeking residency outside of their country for fear of persecution for reasons of race, religion, nationality, membership of a particular social group or political opinion. And then you have people who have been trafficked into Ireland and been forced or deceived to come into Ireland. Immigrant children, unaccompanied minors, or separated children, or children outside of the country. And then, we have migrant seekers are usually understood to be persons deciding to migrate freely. This applies to people and family members moving from one country to another because they want to better their material or social conditions. Then we have irregular immigrants are people who are working without a work permit. This could apply to a failed asylum seeker's application or somebody who's overstayed their work permit, including students, and often irregular immigrants have illegal documentation, false documentation. So these, are some of the families that we face on a regular basis, and it can be very hard. So it's important as family home visitors to know our limitations. So how can home visitors support families experiencing mental health? So I'll just move up here. Tips and tools to build your resilience box. So talking about mental health can be very challenging with the family, particularly if you're not the expert in mental health, but there's an issue. If there's an issue, it is essential not to wait. Talking to someone in an open and non-judgmental space, and where possible with no distractions, is always kind of easier. Hard for sometimes, but it's probably easier than if you're able to get somebody in that space. Let them share as much or as little as they want to. Let them lead the discussion at their own pace. Don't pressure them to tell you anything they aren't ready to talk about. Talking can take a lot of trust and oftentimes a lot of courage. You might be the first person that they've been able to talk to this about. Don't try to diagnose or second guess their feelings. You're not a medical expert, and while you may be happy to talk and offer support, you aren't a counsellor, and that's not your field, is to go in as a counsellor. Try not to make assumptions about what is wrong or jump in too quickly with your own diagnosis or solutions. Keep questions open-ended. For example, why don't you tell me about how you're feeling, rather than I can see you're feeling very low. Try to keep your language neutral, give the person time to answer, and try not to grill them about too many questions. I know for me, years and years ago, I'd be curious about their story as opposed to how the conversation was going, and that over the years then you learn skills and skills to build up on that. Talk about self-care, discuss ways of distressing or practicing self-care, and ask if they find anything that's helpful to them. Again, I'm exercise and have a healthy diet, getting a good night's sleep can protect from mental health. Listen carefully to what they tell you, often repeating back what they said to you so they know that you've actually heard them. You don't have to agree with what they're saying, but by showing you understand how they feel, you're letting them know and you're respecting their feelings. Offer them help to seek professional support and provide information on ways to do this. Help them to talk to a friend or a family member or their GP. Try not to take their control and allow them to make the decisions. And again, most importantly, know your limits. Know what you can and can't do. And if you get triggered or upset by it, always go back and seek support yourself. So I'm just conscious of the time. I'm just going to show one more video. I promise it's just the last one. Is it okay to do that?
You're fine. You're fine
Yeah,
for time.
great.
You're grand.
Thank
You have
you.
another 10 minutes.
Brilliant. Thank you.
Can I just
I don't know what to.
I think
I don't know what to say. I'm sorry. You don't know sometimes what to say, and you're basically walking on eggshells.
Sometimes it can shock people. Someone says you're having a good day. They just expect you to say, yes, Howard, I'm okay. And I'll say, no, I'm not. And some people can get taken aback. Oh.
And I think there's the fear of saying the wrong thing. You know, what do I know about mental health?
I was diagnosed with anorexia nervosa, body dysmorphic disorder, and obsessive compulsive disorder back in 2013. And on Friday the 29th of August 2014, I tried to take my own life.
My name's Hakira and I'm Sandeep's mum, mother, is it?
Best friend.
And best friend.
Dave first joined the Mint session when he was struggling with his mental health, and from there we kind of, in a strange way, hit it off, I think.
It's love at first sight.
I like to think of it that way.
I'm Dr. Will Murcott. I'm a mental health nurse and senior lecturer with the Open University.
For me, listening is at the top of the list. I think that's the first and most important step. If you can, active listening, repeating back some of the things that they've said to you so that they can feel and realise that they're being helped.
That first initial conversation that you had with me when my mum and dad sat me down, that's when the bubble popped for me. That's when I thought at that very moment that someone's noticing how I'm feeling. Someone is noticing and having an oversight of my pain, just asking how you are. It was so crucial and so important to me at that moment.
Ask twice, are you okay? Yeah, I'm all right. But no, are you really okay? And then it's like, well, no, actually, I'm not.
I think there is an urge to try and problem solve and do something. And there's almost need sometimes to be able to fix a problem or a person. And sometimes that's not the right thing to do in that situation.
People aren't necessarily looking for answers. People want to be heard.
One of the things I've learned as a mental health professional is that often if I try and set goals or have my own needs and wants and desires for how somebody should get better, they are usually wrong. And so from my point of view, it's working with a person at their pace and trying to understand how they want to move.
You can suggest go to see your GP, you can suggest support groups, you can suggest people taking an activity. You can go and join in that activity with them, so they're not feeling alone with that.
One size does not fit all. You've had a really great idea, didn't you? The family trusted circle.
So what we do, we go out the family environment and go to a coffee shop or just sit there, all four of us, actually doing our pos and negs. What's been your positive for the whole month? What's been your negative for the whole month?
We spend a lot of time insulting each other. We just send each other little videos or, oh yeah, I've been watching that, and just little clips. Everybody's at the click of a button now.
You're in my pocket.
Yeah.
If they're really struggling and at breaking point, emergency phone lines out there, and Samaritans as well. They need to know that there is support out there. And it's so hard so hard to see that when
You are in a dark place.
you're in a dark place. Yeah.
One of the scary things is that kind of pressure of what do I do if? Because it can be nothing more scary than having somebody talk to you about ending their life, harming themselves in some way. Really, the person needs to know as well at what point you will find something acceptable or unacceptable, and then have to do something or involve somebody else. I always try and get that conversation done as soon as I can, to say, look, I will never breach your confidence, but if there are things that worry me, then I may have to do something about that. And again, that's absolutely okay, because the person will thank you for it afterwards.
Let people know that I'm here and we're going to do this together. So if that means, right, me and you, we're going to make an appointment at the GP, we'll go together and we'll do this together. And it's about being in the mud together.
You have to keep your own emotional batteries charged up, because when they're drained out, you can't help anybody else and you struggle to function, let alone just trying to look after yourself. The plane and the oxygen mask, put your oxygen mask on first. Self-care is the number one priority, I think.
So I don't think you can actually fail, and that's something that I would really push to everyone who's helping someone with mental health struggles, is you haven't failed, you cannot fail, but you can do something.
Trust your instincts, be yourself.
The right thing was probably what you first felt, and that could have been sitting and listening, just nodding, or it could have been responding, tell me more about that. So not to over-worry, not to overthink, but there is support out there, and there are people that will listen to you and give you advice and guidance.
And it's important to talk. Oh my God, it's so important to talk.
Very important to talk.
We had most chats with love you, man. It's good to have someone like Josh in my life. It makes my life better.
So again, just don't judge or criticize, be patient, learn about mental health, listen, stay in contact, pay attention, and be forgiving. So the gifts and tools, and resilience we bring as home visitors to families. So we provide a non-judgmental space for our families. We hold our families in unconditional positive regard. We have the skill to be truly present for our families. We are professional at all times, adhering to the standards and ethics of our home visiting projects. We understand the importance of staying in the space of home visiting practices. We seek support from our organisations when in doubt. We meet our families where they are at in the present moment, in this day, this week, month, year, remaining flexible to their present state. We believe in the resourcefulness of our families, even during times when families do not believe in themselves. We have the capacity of staying with powerful emotions, allowing our families to express them in a safe and supportive environment. And we are professional in knowing that when families drop off or stop linking in with the service, we understand that this is not down to our lack of support or seen as a failure, but maybe at this stage, the family is not in a place where they're able to receive the support. So, sorry, let's move on. So I'm going to go through that. So signposting, your manager, supervisor, go back to your team leader, if whoever, your colleague. Again, the first step is GP or in an emergency 999. Then we have talking with family and friends. It can be difficult, but signposting can make a real difference. So here are the next two slides are kind of different organisations that you can tap into. So we have Aware, the Samaritans, Parent Line, Bodywise, Create a House, Turn to Me, Grow, Eveness. And then we have the Irish Advocacy Network, support and information for people with mental health difficulties, Parent Line, Counselling and Psychotherapy, Shine, Childline, Women's Aid, and the Dublin Rape Crisis Centre. They're some of the support. So supporting the well-being of home visitors. Again, you can do this in your own time. This is something about, it's kind of reflective practice. So this is the chart that you can look at. So you look at the different various aspects in your life. And if you score it on a 1 to 10, so there would have been times in my life where I would have been business, career 10, and maybe family and friends 1. So that's way out of balance. So it's about looking at that from a perspective of positive health and trying to bring it in balance, that there's not too many dissimilarities. So that's just for yourselves. And then mental health, taking care of home visitors. Home visitors are key to delivering effective support services to families. It is imperative that home visitors become very aware of how their own mental health can be affected. When home visitors hear and are exposed to constant challenges and trauma of others, this can contribute to burnout, poor physical health and mental health for home visitors. Home visitors' own awareness of their abilities and capacities are key in taking care of their own mental health and in seeking support around personal challenges that they may face. So a few questions that home visitors could ask themselves are, what factors contribute to my own mental health and well-being? What can I do for myself to support my own mental health? And how does my own mental health and well-being influence the service quality? How can I and my service reduce stresses and support home visitors more? So again, this is just a group question. If I'm just conscious of the time, again, one more video. I promise you this is only like 1 minute. Will I play it?
Yeah, go ahead. You're fine, honestly. And then we're going into breakout rooms.
Yeah, brilliant.
How heavy is this glass of water? Melissa, would you care to answer?
8 ounces,
12 ounces,
16 ounces.
The absolute weight of the glass doesn't matter. It depends on how long I hold on to it. If I hold it for a minute, nothing happens. If I hold it for an hour, my arm will begin to ache. If I hold it all day long, my arm will feel numb and paralyzed. Well, the weight of the glass hasn't changed, but the longer I hold on to it, the heavier it becomes. The stresses and the worries of life are like this glass of water. If you think about them for a little while, there's no problem. Think about it for a little bit longer, it begins to hurt. You think about them all day long, and you'll feel paralyzed, incapable of doing anything. Always remember, put the glass down.
That's it now. Will I stop the sharing?
Yeah, please. That'd be great. Thank
Yeah.
you. Lads, Anita, thanks very much. Absolutely great tips for the home visitors. Just even getting to know more about mental health in general, because I didn't know half of that stuff, you know, like really. So just want to say thanks so much.